This is Tamangu village in Kitgum district. 23-year-old Neil Kidega is seated under a tree in the compound of their home. He was diagnosed with nodding syndrome in 2000 and has been battling the deadly condition since then. And it has taken toll on his body. He has considerably lost weight and appears malnourished. But he is somehow lucky because there is always someone at home to ensure that birds do not peck his wounds. He is not alone. Scores of other children in similar conditions are ailing at home because they can't afford to stay at health centers. Besides, there are also no facilities for admission in public health centers. The health facility nearest to Kidega's home is Kitgum District Hospital, about 30 kilometers away. The hospital has a ward for people with nodding syndrome, but it is half empty. At least 40 cases are reported here every week. Michael Ketch, a psychiatric clinic officer at the hospital, explains the condition of the patients.
That one was severe burn was epilepsy and as a result of nodding. Then there's that one again. Reasons why he had that severe burns, there was defaulting of treatments. After some time they leave the treatment for some period, and once they leave the treatment, the diseases come back very fast and they come in a very terrible conditions. So that is why you see them with that severe form of burns.
The patients cannot take medicine as regularly as they should because sometimes there is drug stock out in government health facilities.
So anticonvulsant like the carbamazepine, almost countrywide that, but Kitgum was lucky enough, we have not run short of it.
Kitgum Hospital no longer provides food, yet most of the parents cannot consistently provide the much needed food to the affected children.
I think almost coming to a year. That's the problem, that we are not receiving any supply.
So that discourages patients. How do they
survive? Not discouraging the patients, because they come, we see sometimes a really very big challenge to us sometimes when we see some families coming from very far and the food service not there. It came to a period when some clients are supporting the caregiver supporting another caregiver.
In a ward that can accommodate about 15 patients, only 5 of them are here. And the main reason as to why most of the children are languishing out there in the villages and cannot access such facilities is because even when they report here, they cannot afford a meal in a day. The hospital is in a process of procuring a new food supplier, although the process is slow. I asked Dr. Geoffrey Akena, the focal person in charge of nodding syndrome response at the hospital, why the process is taking so long, yet there are many lives at stake. Are you not ashamed that as the hospital leadership, it takes you a full year to get someone, a supplier of food, and then people are suffering?
No,
Does
not
it
really.
shame you?
Not really. You know, here we don't look at an individual, don't look at one institution. This is a district program, this is government program.
So do you believe maybe there is a failure in delivering services?
I wouldn't say that.
The system is limping?
In any organisation, the system can be slow, okay? Can be slow, but they are gearing towards quality.
Annually, government has been spending 12 million shillings on food for the ward. This translates into 1 million shillings per month and 33,000 shillings daily. It costs only 33,000 shillings to provide a meal for these people suffering from nodding syndrome at this hospital. And the longer it takes, the more the people feel neglected. Sudil Biarhanga, NTV.